Dupixent is a medication that's been changing the way we approach chronic conditions like asthma and atopic dermatitis. You might have heard of it, but what makes it stand out? In this video, we'll take you through 10 facts about Dupixent that will give you a clearer picture of how this medication works, how it's used, and what you should know if you're considering it for treatment. Whether you're a patient or just curious, these facts will shed light on this game-changing biologic. Number 1. What exactly is Dupixent? Dupixent is a biologic medication that contains the active ingredient dupilumab. Unlike traditional pills, it's delivered through injections. Dupixent works by targeting specific proteins in your immune system that cause inflammation. This is crucial for treating conditions like asthma, atopic dermatitis, and even chronic rhinosinusitis with nasal polyps. It helps control flare-ups and makes symptoms more manageable for those who haven't found success with other treatments. When you think about biologics, it's important to know they're quite different from regular medications. While typical drugs are made from chemicals, biologics like Dupixent are derived from living cells, making them more specific in how they work. Dupixent is approved for several conditions, so it's really become a go-to treatment for patients dealing with long-term inflammatory issues. Number 2. How did Dupixent get approved? Dupixent's approval journey is one that's garnered a lot of attention. It was first approved by the FDA in 2017 for the treatment of moderate to severe atopic dermatitis in adults. Since then, it's expanded its approvals to cover other conditions like asthma, eosinophilic esophagitis, and chronic rhinosinusitis with nasal polyps. Dupixent was developed by Regeneron Pharmaceuticals and Sanofi, both major players in the pharmaceutical world, and has since become a revolutionary treatment for chronic conditions that were previously tough to manage. What makes Dupixent so significant is that it's one of the first biologics approved for these conditions. Before its approval, patients often had to rely on steroids or other less targeted therapies. With Dupixent, it was a breakthrough because it targets the root cause of inflammation rather than just masking symptoms. Its rapid success in treating several conditions has only increased its popularity. Number 3. What conditions does Dupixent treat? Dupixent isn't just a one-size-fits-all treatment. It's used to treat a range of conditions, primarily focusing on chronic inflammation. Atopic dermatitis, eczema, is one of the most common uses, where Dupixent helps clear up the skin rashes and itching that come with flare-ups. But it doesn't stop there. It's also prescribed for asthma, especially for those who have moderate to severe symptoms and need better control. In addition to these, Dupixent has been approved to treat eosinophilic esophagitis, a rare but serious condition that causes inflammation in the esophagus, and chronic rhinosinusitis with nasal polyps. This versatility is part of what makes Dupixent so valuable in the world of biologics. For patients with these chronic conditions, Dupixent offers a targeted, effective treatment to manage symptoms that were often resistant to traditional therapies. Number 4. How does Dupixent actually work? Dupixent works by targeting and blocking two proteins in your immune system, IL-4 and IL-13, that cause inflammation. In conditions like asthma or eczema, these proteins trigger the immune system to overreact, leading to inflammation and the painful symptoms that accompany it. By inhibiting these proteins, Dupixent calms the immune response, reducing inflammation and helping to manage the symptoms. For example, in asthma, inflammation in the lungs can make it difficult to breathe. Dupixent reduces that inflammation, making it easier to manage asthma symptoms. In atopic dermatitis, it works by calming the immune response that causes itchy red skin. Dupixent isn't a cure, but it's incredibly effective at controlling flare-ups and keeping symptoms in check, offering long-term relief for many patients. Number 5. What's the dosage and how do you take Dupixent? Dupixent is given through subcutaneous injections, which means it's injected just under the skin. It's typically administered using a pre-filled syringe or an auto-injector pen, making it convenient for at-home use. When you first start treatment, there's usually a loading dose. This is a higher initial dose to help get the medication into your system faster. After that, you'll typically receive maintenance doses every other week to keep things on track. The exact dosage depends on the condition being treated. For atopic dermatitis, for instance, you might start with a 600 mg dose. administered as 2 300 mg injections, followed by 300 mg every other week. For asthma, the starting dose could be 400 mg, followed by 200 mg or 300 mg every other week, depending on the severity of your condition. Your doctor will guide you on what's best for your specific needs. We made a book, 10 questions everyone should ask their pharmacist. You can find a link in the description below. Feel free to check it out. Number 6. Are there any side effects to be aware of? Like any medication, Dupixent comes with potential side effects. Most people tolerate it well, but some might experience injection site reactions, like redness or swelling, especially when they first start the medication. Other common side effects include eye issues, such as redness or irritation, and joint pain. These are usually mild and tend to go away with time. However, there are also more serious side effects to be aware of, although they are rare. Some people may develop allergic reactions, including difficulty breathing or a rash. Dupixent can also affect the immune system, which means there's a small chance of developing infections or eye problems like conjunctivitis. It's always important to talk to your doctor about any new or worsening symptoms, so they can adjust your treatment plan if needed. Number 7. How does Dupixent compare to other treatments? Dupixent has quickly become a first-line treatment for conditions like asthma and eczema, especially for those who haven't had success with traditional therapies. Compared to corticosteroids, which are often used to treat inflammation, Dupixent targets the root cause of inflammation rather than just suppressing symptoms. This makes it a better long-term solution for many patients, especially since long-term steroid use can have significant side effects like weakened bones or skin thinning. In asthma, Dupixent may be recommended for patients who need more control over their symptoms and want to reduce their reliance on oral steroids. Unlike inhalers, which focus on immediate symptom relief, Dupixent works to prevent flare-ups and reduce overall inflammation in the body. Its biologic nature makes it more specific in its action, leading to better overall management of chronic conditions. Number 8. Is Dupixent expensive? One of the downsides of Dupixent is its cost. As a biologic, it can be quite expensive, especially without insurance. A typical year of treatment can cost tens of thousands of dollars. However, for many patients, the cost is reduced significantly through insurance coverage. It's also important to note that Dupixent offers a financial assistance program called Dupixent My Way, which can help eligible patients with co-pays and other out-of-pocket expenses. If you don't have insurance or need additional help, the My Way program is worth looking into. It's designed to make Dupixent more accessible to those who need it most. Even with the high cost, the effectiveness of Dupixent in treating chronic conditions can make it a worthwhile investment for many patients. Number 9. How does Dupixent improve quality of life? For patients dealing with chronic conditions like eczema or asthma, Dupixent can significantly improve quality of life. By reducing flare-ups and making symptoms more manageable, many people find they no longer need to rely on oral steroids or other medications that have harsh side effects. This can lead to fewer doctor visits, less time spent managing symptoms, and a better overall sense of well-being. For those with atopic dermatitis, the improvement in skin condition alone can be life-changing. No more constant itching, painful rashes, or sleepless nights. Similarly, asthma patients who use Dupixent often report feeling less breathless and better able to manage their symptoms day to day. By addressing the root cause of inflammation, Dupixent offers real relief, giving patients more freedom to live their lives. Number 10. What safety precautions should I consider? Before starting Dupixent, there are a few safety precautions you should be aware of. It's not recommended to receive live vaccines while using Dupixent, as it can interfere with how your body responds to the vaccine. Talk to your doctor about any vaccines you need before starting treatment. Dupixent may also cause eye problems, so if you have a history of eye conditions, be sure to let your doctor know. As with any medication, it's important to stay on top of regular checkups and communicate with your healthcare team about any side effects or changes in your condition. Dupixent is generally safe, but ongoing monitoring can help ensure it's working effectively and that you're not experiencing any adverse reactions. Always follow your doctor's guidance and keep them informed about your health status. Hey, I'm Dr. V and welcome to my channel. Please check more of my videos about health and medications. And cheers to a healthy life.